Good day, class. In this video, we are going to talk about female infertility. Female infertility refers to the inability to conceive after at least 2 years of unprotected sexual intercourse with a healthy male. Similar to the other diseases that we have introduced in this session, female infertility also can be categorized into primary female infertility and secondary infertility. The secondary female infertility is result from other diseases. Other diseases cause infertility. So the reason why we need to clarify these two different types is because the treatments or focus may be different. For secondary, you must focus on the initial disease. Because of the fertility issue, this issue related to both male and female. This is quite a common situation in infertility. According to the statistics, female infertility contributes about 40 to 55% of infertility, and male will be about 25 to 40. And in some situations, both female and male, both parties will have problems. So in this situation, the treatments, we will need to focus on both sides. When we see a patient present with infertility, a female patient present with infertility, the first thing that we need to ask the patient to do is actually to ask her partner to do the sperm analysis, routine sperm analysis. This can help us to ensure that the infertility issue is not from the male part, from the female, and then we can focus on the female. If the routine sperm analysis shows some abnormal, and then we will need to focus on both. The reason is because for male, it's kind of easier to identify the health condition only from the routine sperm analysis. But for female, there are hundreds of causes that may result in infertility. That's why sometimes it is a bit difficult to identify the actual reason, actual cause of female infertility. So just as the principle for female infertility, the first thing you must ensure that the male is healthy. In Chinese medicine, we realize this issue from quite early. This issue also even earlier, much earlier than Huangdi Neijing. The first text that records female infertility was in Zhou Yi. Zhou Yi, if you still remember, this is the literature books, no medical works. This book was written about 11th century BC. So this is about 3,100 years ago. In that text, it described as female infertility refers to the female that cannot conceive after 3 years. And in Huangdi Neijing, the authors propose that the causes of infertility is the kidney qi should take the responsibility of fertility issues. And this also can reflect in menstruation. So we will see afterwards, we're going to emphasize the menstruation, the cycles. There was a saying in Chinese medicine that to treat infertility, you must regulate the menstruation. So to treat fertility issue, the first step is to treat the menstruation, to regulate menstruation, and then for fertility. But although from the from the text, you will see there are two steps, menstruation and infertility. But in fact, to treat the menstruation, we also assist the fertility. The reason is because the causes are similar. The causes in terms of the pathogenesis, such as qi and blood deficiency, or excess due to either phlegm dampness or stagnation, etc. But when you understand this principle, you will understand that it is very important for female to have a regular menstruation. The regular menstruation also can reflect in modern science, in modern science or in conventional medicine. The regular menstruation also can indicate the normal hormones or those 6 different hormones. So the menstruation is very important. If a patient presents with irregular menstruation, your first aim must focus on the menstruation to regulate the menstruation in terms of the period, the cycle, in terms of the property of the period, the volume of the period, the properties such as the color, clots. These can help you to identify the condition of the uterus. So our treatment will focus on the kidney, focus on the uterus. In 神农本草经, 神农本草经 is the material medical book. It describes that if the wind cold attack the uterus, the lady will result in infertility. And it describes that the lady will have 10 years infertility issue. Although the 10 years, this is not accurate, but it already indicates how severe, how difficult to treat this problem when cold attack the uterus. From this text, we also will understand that another cause, apart from kidney deficiency, another cause for infertility also may due to cold retention in the uterus. That's from the etiology, as you can see on the slides, the cold retention. Similar to the other diseases that are related to menstruation, fertility issues always have very close relationship to Cong meridian and Ren meridian. So in our treatments, we're also going to focus on Cong meridian and Ren meridian. For acupuncture specifically, we still can use some points in Cong meridian and Ren meridian. Later on in other texts, the other classic texts, different authors, they propose different causes of infertility, and these causes, many of them related to menstruation. For example, in Tang Dynasty, that's about 1,500 years ago, there was one book that have an individual separate chapter for female infertility, and the titles, the author proposed a few titles such as infertility with no menstruation, infertility with menstruation blockage, infertility due to the coldness in the uterus, infertility due to the career issues. See, for these different categories, different titles, you will understand that the authors in the past, they try to identify the actual cause of infertility, because this will determine your treatments in the future. In the other texts, the author also proposed that fertility issues also may due to dampness and phlegm dampness. So this, in which situation the patient will have phlegm dampness, such as obesity, overweight patient who suffer from infertility. A very skinny patient, also very difficult to conceive. In the previous video, that when we studied amenorrhea, I mentioned that there's one situation, a lady wants to lose weight, and once she becomes very skinny, there's no menstruation. the qi and blood in the body not even enough for the normal health or just general health. That's why there will be no maturation. So a very skinny patient, even with no maturation, so the uterus is very difficult to retain the seeds, kind of a seeds, so that to conceive. The cold retention in the uterus, I sometimes tell the patient or discuss with the patient, so just to use a layman words to explain why we need to keep warm, for the uterus in terms of the temperature, in terms of the property. So to keep warm, when we talk about the principles or the patient's advice, avoid cold environments, to keep warm in the lower abdomen, to keep warm from the diet. But sometimes the patient will ask you why. What's the philosophy behind these actions? I will ask them to think about the plants. Do you plant your seeds in winter or in spring or summer? Is it easier to plant a seeds for a flower or tree in winter or in summer? Everyone will answer you that obviously in spring, late spring or summer, then you can plant the seeds. This is due to the temperature of the environment is warmer, and it will be easier to let the seeds to sprout. So similar to our human health, when the uterus is warm enough, it will be easier for the seeds, which is the sperm and the eggs, to grow, that's to conceive. So this is the phenomenon that we can see from nature that we apply in human health. Fertility, the treatment for fertility, we must emphasize the age. For female, the ability to conceive is declining after the age of 30. If after the age of 40, it's even more difficult. That's why for infertility, the treatments, the earlier the better. The younger the ladies, the better. From this point of view, you also will see sometimes it's quite difficult to treat patients over the age of 40 or 45. In this situation, especially in South Africa, sometimes it's very common. People want to do IVF and with the combination of acupuncture. So when you treat this kind of patient, you must explain to them well. Acupuncture cannot ensure to fix the problem. The reason is from their age. Similar to the other diseases, the etiology, apart from these two deficiencies, also can be excess. So different excess and deficiency. The kidney deficiency can be kidney qi deficiency, kidney yang deficiency, kidney yin deficiency. But no matter what type of syndrome that we identify, the patient may present with accompanying symptoms. Yang deficiency, cold hands, cold feet, dysmenorrhea, the painful menstruation with clots. You see, all these can link nicely together. The menstruation, the one that you have studied in the menstruation, the symptoms that you have studied in amenorrhea, these are all can contribute to your diagnosis of infertility. For kidney yang deficiency, the symptoms also can have such as the pale color, the kidney deficiency here. In your treatments, you must further identify is kidney yang deficiency or kidney yin deficiency, or kidney qi deficiency. If a patient presents with kidney yin deficiency, we have a red tongue with scanty coating, thin pulse. Okay. So these are all the knowledge that's from your diagnostics. Liver qi stagnation for excess begin to activate the circulation. Phlegm, overweight, the patient may be overweight, obesity. Delayed menstruation with clots, greasy coating. So the treatment principles depends on the situation. You're going to select the specific principle for your syndrome. The points that you can use, such as blood 18, stomach 40, 29, actual CA1 子宫. So this one, actual CA1, this is the one I mentioned for uterus specifically in the lower abdomen. Spleen 6. As you can see, these points have different functions, such as stomach 40, used for phlegm. This one is more for gynae problems. 肝疏, blood 17. Blood 17 related to liver. Spleen 6 related to the 3 meridians of 3 in meridians. The reasons for multiple reasons. Firstly, the liver stores the blood, so it can help to regulate the menstruation. The liver, especially for the stagnation, the liver can activate the stagnation. 18. And also the Back-Su points, the function of Back-Su points more used for tonifying, so for deficiency. That's why for deficiency, we can use Back-Su points. Apart from these, we also can use other points that are related to kidney, such as the Back-Su points of kidney 3, and these are different points that are related to different syndromes. Distending pain. This distending pain is more in the chest region. Perfumes and leukorrhea. If I'm not wrong, we don't have a separate session for leukorrhea, but this is something you need to remember. For leukorrhea, you can use points at the lower back. So those 8 points, and say the 8 points at the lower back. For deficiency, you will use points on the Rome meridian, Rome 4, Rome 6. You also can use the combination of acupuncture and Moxibustion, kidney 3 to 4 to 20. The general principle, this one, acupuncture and Moxibustion with foods. So this is the combination of Moxibustion with the foods cake that we have introduced. The reason for this also try to improve the heat, strengthen the heat to tonify the yang deficiency, relieve the yang deficiency, to tonify kidney yang. How to apply these treatments in practice? Just in general, we can follow this category. We're going to treat according to the syndrome, such as kidney deficiency or liver stagnation or phlegm. Then we're going to select the points that's proposed in the slides. You're going to apply the treatments once a day or every second day or at least twice a week. You see, for infertility, sometimes it's quite difficult to continue the treatments for every day. The reason is because this problem is a long-term chronic, kind of chronic. If the patient is lucky enough, she may conceive quite quick afterwards. But sometimes if the patient is not lucky, the treatments sometimes may last for a few months or even a few years. So if you ask the patient to do the treatment every day, sometimes it's just impractical. So you can advise the patient to have his treatments during the break, so not during the cycle. Once the cycle starts, the period starts, we stop the treatment. So during a break, you're going to have the treatment every second day, so 2 to 3 times per week. You can follow the prescription that we propose here. Another treatment principle that you can use, you can think about is according to the cycle. According to the cycle, it refers to the development, the cycle, the yin and yang development. From the day 1 to day 14, the follicle is going to grow. So this is the yang, the kidney yang development. Because the eggs, from initial eggs, they grow to be mature eggs. This is the physical change, the growing. This is the yang energy, the kidney yang. But from day 14 to day 28, day 14 to day 14 to the 15, just after ovulation, day 15 to 28, this is the yin. So you also can follow this principle. In the first 2 weeks, you're going to tonify kidney yang to promote kidney yang. In the second 2 weeks, you're going to tonify kidney yin, and you can continue this treatment for a few cycles. This is also a new theory, a quite popular theory that's for infertility. You're going to separate the cycle on the half. The first half, kidney yang, because the eggs is growing. And from the second half, you can do tonify kidney yin, so you will have 2 groups of the acupoints, one focusing on kidney yang, the other one focusing on kidney yin. In this situation, you try to regulate the menstruation cycle. This type of treatment also can be used for irregular menstruation. In this video, we mainly introduce female infertility. For female infertility, we must understand the definition: at least 2 years, a healthy partner, the female, at least 2 years. And the treatment principles, or the thing we need to think about for this type of treatment, is the first thing is menstruation. Whenever a patient presents with infertility, you must ask about their past menstruation history, irregular, the type of the cycle, the nature, the property. So anything related to menstruation, you must ask clearly, because these will help you to identify the property, the constitution of the patient. Sometimes I also will ask the age of their parents. The reason is because I want to know when she was born, what was the age of their parents. Because if the lady from a senior patient, a senior parents, then this patient may have a weak body constitution, a weaker kidney constitution. So in your treatments, you may already link to kidney deficiency. So for senior age of their parents. With regards to the diagnosis, you need to differentiate the secondary infertility. Thus, we will refer them to see their gynae to exclude some common diseases, such as some inflammation in the female reproductive organs. In the treatments, we're going to focus on the symptoms. So that's why we have kidney deficiency. Although in the notes, we don't have a kidney yang deficiency and kidney yin deficiency. In actual practice, we must identify further kidney yang, kidney yin, or kidney qi, or even kidney exomes deficiency. So for kidney deficiency, there are 4 types of deficiency. You may use different points according to the syndromes. There are also excess, such as phlegm dampness, liver qi stagnation. So your treatments will be based on these different syndromes. The frequency once a day is most ideal, every second day, or 2 times a week. So because we require the frequency. Or in the other alternative way that you can do is according to the cycle. In the first 2 weeks, use kidney yang, you tonify kidney yang. In the second 2 weeks, you use techniques to tonify kidney yin, mainly focused on yin and yang according to the cycle. Thank you for your attention.